Yeah, my name is Heun. I'm a consultant psychiatrist and professor of psychiatry and editor of Global Psychiatry Archives. And today I would like to talk about the CS Mental Health Explains. I would like to give some information today about the examination of a patient who has psychotic symptoms. Usually it's not just schizophrenia, but many diseases which can affect the brain, which also can cause psychotic symptoms such as paranoia, hearing voices, seeing, having delusions, seeing things which are not there, so visual hallucinations or else. So physical problems might be important, which again, as I said, affect the brain. Neurological disorders might be headaches, head injuries, previous dizzinesses or faints. Sometimes the nerves of the brainstem might be affected, which leads to abnormal movement of the tongue or the mouth. Double vision, hearing or visual impairment might be a problem, and delusions are more common in people who have sensory impairment, like visual or hearing impairment. People have to look for, or doctors have to look for, a history of fits, faints, blackouts, dizzy spells, altered consciousness or memory problems. There might be a history of a stroke, diabetes, coordination problems, or a tremor, which all give some evidence of neurological symptoms. Respiratory problems might be important, dyspnea, autopnea, cardiovascular problems, palpitations, chest pain, which might indicate that there is some affection of the brain blood flow. Gastrointestinal problems might be a sign of anticholinergic effects of antipsychotic drugs. Nausea, vomiting might be a problem. So that's bad. Genitourinary problems, so might be again a problem with the medication. Infections might be problems. Sexual problems might be effects of medication. So these things need to be examined. The mental state examination needs to feature on the mood, the sleep, anxiety, cognitive functions, looking at orientation. People with delirium have attention deficit, poor concentration, and poor orientation. And the memory is important. And so when disorientation is present, and disorientation and confusion is part of the paranoia, or comes with the paranoia, then the brain problem might be existent. Right, so if you don't find a specific affection of the brain, there might be other indications or contributors to brain disorders. There might be family history of mental health problems, a family of history of psychiatric illness. Substance abuse is a big problem in paranoia, which can cause to psychotic symptoms. History of obstetric complications is prevalent in schizophrenia. Sometimes a brain injury or history of brain injury can cause to psychotic symptoms, and people should especially look at the temporal correlation between symptoms and the physical health problems. On the other hand, it might be that the psychotic symptoms come from stress, stressful life events, frictions in the family, difficult living conditions, and difficult conditions of life and environment. So what I would like to say is that full physical examination for a person who has the first symptoms of psychotic symptoms is completely necessary. and it should be done in the outpatient setting, or if you have the luxury, you should ask them or should expect that the GP who refers for mental health assessment of psychotic symptoms has done a full physical health assessment. Right, so systematic comorbidities shouldn't be overlooked, so let's say it that way. A lupus erythematosus, it can cause psychotic symptoms, and psychotic symptoms should also be a cause to look for physical health problems, including dermatological problems, which are rare but shouldn't be overlooked because they can be treated. So the point of looking at physical health problems in people with psychosis is not just an academic idea, but it's also necessary to see whether these physical health problems or their treatment can improve the mental health conditions. And so physical health problems, I mentioned, a full neurological examination would be important, at least for a first time. And after the physical health examination and the history is taken, there might be some blood tests, which might be urea and electrolytes, calcium, full blood count, and glucose, as also liver function test. If there's a history of, let's say, possible sexual disorders, so there should be a check for gonorrhea, syphilis, which all can affect the brain. Tumor markers might be important, and cortisol as well. Thyroids, let's say hypothyroidism or severe hypothyroidism, can also lead to slowness and paranoia, where very often it's not totally clear how it works. If there's evidence of neurological symptoms, there should be a CT or an MRI scan, and if there's physical problems like cardiovascular problems or respiratory problems, a chest X-ray might be helpful. Urine might be helpful to check for stimulants and cannabis. Sadly, drug use is very common among people, and these drug use can lead to immediate or delayed psychotic symptoms. An EEG can help, showing if there are side differences in the activity of the brain, or if there's a slowness of the activity of the brain. But it sometimes doesn't lead to very much, because what you already see is that the brain doesn't function, and then the EEG doesn't function as well. So that's what you expect anyway. So it's more important to do something or find out something which you can treat. Right, in specific circumstances, cortisol can be assessed or catecholamine should be assessed, but that's usually for the physical, for the GP to look for these diseases, including Cushing or pheochromocytoma. Usually mental health problems wouldn't be the first ones to cause or to be the first symptoms of such diseases. So let's say it that way, it's good to know the history, and maybe it's always good to have an overview about the physical health of the patient and the living conditions. Thanks for your interest, and I hope you enjoy this series as well as this video, and if you do, please feedback, like, and subscribe to our channel, which will give quite a few and quite reasonable information about mental health problems in general. Thank you.